Good evening. It was 1 year ago today. A man who had traveled to Wuhan, China, was admitted to Sunnybrook Hospital with what appeared to be a mild case of pneumonia. Now, that patient was later confirmed as being patient zero, Canada's first presumptive case of COVID-19. That moment spiraling into a year that many will never forget.
The case is in a male who's in his 50s. He had traveled to Wuhan, China, and come back, and within a day became quite ill.
That was the moment Canada was made aware of the first presumptive case of the coronavirus now within our borders.
We were notified of the presumptive confirmed case of coronavirus. We started our actions in terms of public health.
The announcement coming just 2 days after patient zero was admitted to hospital. Dr. Jerome Lees remembers getting the call.
And so when we got the result back, within 2 days, I did, go to the unit with a number of other team members. We had a huddle, and I remember that there wasn't a whole lot of surprise. I think people were expecting this by then.
Dr. Lees says protocols were already in place thanks to the experience healthcare officials gained from the SARS outbreak. But still little was known about the virus, its severity, and how it spreads.
A lot of comparisons were made to SARS and also MERS, so as novel coronaviruses that caused significant epidemics in the past. But really, as time went on, the comparisons to those just became less and less relevant. COVID-19 is very different.
Healthcare workers at Sunnybrook Hospital felt prepared, but what came as a challenge was testing. While all of the signs of COVID-19 were there, Canada has never ran a test for the virus, and it was imperative to get the result as quickly as possible.
It was just a race to be able to try to confirm the diagnosis because there hadn't been a positive test in Canada, and the lab had just completed validation for the test and was really looking to put it to use. And so this was a good case to do it.
But no one would have ever predicted the rapid spread of the virus, with cases in the thousands and far too many lives lost.
We still have incredible challenges ahead. As the virus continues to mutate and new variants of concern are emerging, we need to remain open to the possibility that we still have a ton to learn about this virus that's been so challenging.
The next day, patient zero's wife would become the second person to test positive for the virus in Toronto. Both patients have since recovered from the virus.